We have a great opportunity to celebrate the history that we have in terms of healthcare in the region and area, and then also to adjust those things that aren't quite working the way that we want them to. And so this is our ability to grow as our culture has changed, as our people have changed, as the community around us has changed, and so we can embrace diversity, we can foster an inclusive environment and a collaborative environment. And so we have an opportunity with a new building to also look at what other new things do we want to build into the work environment. And so that's our culture. It's the way we treat each other, the way we treat our patients and families, how we interact, how we communicate together as a healthcare team. All of the team members, whether you're in support services, clinical support services, or direct clinical delivery, I think we have a great opportunity here to become the North Star of the North Zone and the Northwest part of this province, and look at how we do things and how we want to be doing things.
A place where people can come confidently and with the hopes that they will get the service that they need and wish for themselves and their loved ones, where they feel they are being taken individually as a person with the need to be respected and valued for not only their medical needs but also their cultural background.
When people come to Alberta Health Services, it's very rarely in a positive state of mind, and being able to see a diverse community, such as the community they come from, is going to make them more comfortable while they're here. It's going to improve our service delivery, and it's going to hopefully improve outcomes.
I think, whether we're talking about Grande Prairie or the North Zone or across the organization, we're always aimed at striving to do better, to be better. And that couldn't be more true than what is happening in Grande Prairie. I think recognizing, and this is really what our position statement says, is to look at our truth, look at where we've been, to be prepared to listen and to hear some hard truths, and then to be able to commit to moving forward, and then take that commitment into action. And that's what Grande Prairie is doing, is really looking at how we can actively be a place where people want to work, where people want to access healthcare. And so I think, looking forward with creating and supporting an overall culture of inclusion, where we all stand up for each other, where we speak out against racism, where we speak out against discrimination, where we take a stand when we see something wrong. It is that culture that creates a place that we all want to be part of. And that's what Grande Prairie is doing through a number of initiatives.
I think we continue down the path that we're going now, being inclusive to multiple groups. That's an incredible way forward, right? I've been to hospitals in Saskatchewan and BC due to family members, right? And had a conversation with some of those departments. They really haven't pushed these boundaries yet, right? So Alberta Health Services is pushing that front.
When there's negative things happening in terms of inclusion and diversity, when we're a bystander, we are still, to me, that's the same as supporting it. So being able to do something about it, learning how to do something about it, becoming involved with it has been really helpful for me personally and professionally, to help support the staff and to be able to teach them and assist them to be upstanders, meaning that when we see something going on that isn't right, that we stand up for it, that we stand beside our colleagues and our partners.
Talk about respect. It's a two-way street. The patients and family members have to have respect for the staff and medical professionals here at the hospital. On the other side of the coin, not only do the medical professionals, the nurses, the doctors, and people that work here to demonstrate, to show, and be able to demonstrate respect for everybody and not just Indigenous people. And so I think in the long term, we do need more cultural awareness, training. We need people to fully understand traditional medicines, traditional ways of dealing with certain things that the Indigenous people may want or expect. So I think that's the long-term aspect of when the hospital starts up, is what kind of programs or what kind of training is going to be available to ensure that the workers here learn more about cultures, and the more they understand, easier to show and demonstrate respect for that culture.
Through the diversity inclusion work and the Indigenous work that we've been working and partnering with our community on, it's demonstrating that we want to hear from people, that we care about the stories, we care about their lived experience, and we actually want to create an environment that celebrates those differences, celebrates culture, celebrates language, celebrates who you are and what you bring to the site. And so whether you are a born and raised Albertan like myself, or someone that's come from outside the province or outside the country, you have a specific skill set and who you are you can bring to this site, and we're richer because people bring their whole selves to work.
Welcome to your new workplace, Grande Prairie Regional Hospital.
Come join us as we enhance our culture of care for ourselves, our patients, and our community.
Together, we do amazing things every day.